how much ended up online that we were sitting here jaw jacking. Not that I jaw
Some of that can be edited out too.
Well, that's what I thought, but Ryan left it in. He likes some of that raw stuff to give it real life. Mm-hmm. Yeah, this is
Okay.
all right.
Okay, thumbs up. We're on.
All right. Hey, Keith with PrevailOverCancer.com, and I am Paul at Hyperbaric.plus in Oklahoma City, 122nd in May, and I'm glad you're with us again.
Yes.
Keith, this last week I had a couple of clients. One of them just stuck out like a sore thumb. A doctor up in Tulsa sent him to me dealing with cancer, and we got her in the chamber, and this chamber here is a detox machine. People really don't understand what it does, but when you get in that pressure for a period of time, it's going to mobilize stem cells. If there's pathogens in your body, if you're dealing with some of the Lyme disease is one of them, mold is one of them. You have those pathogens where it's literally going to kill some of those pathogens, and you're going to have a response to it. And so I get a letter.
You may have
You may have,
yeah. Not everybody's going to have a problem.
But
right.
if you have those, the percentages are pretty high. You're going to have some response to it. And how many businesses do people walk out of and go, I feel worse than I ever did in my life. I'm doing good. I mean, that's what happens is because they're detoxing and they understand that. So anyway, this gal had been down in Texas doing hyperbaric oxygen down in Texas, and she did one dive with us, and I've got to believe that one dive mobilized some things. And so she was very kind in sending me a response back. She goes, I don't think this is for me. I got really, she listed out all the things that was bothering her when she got out. I think it's co-infections, pathogens. There's other things going. I don't have people that are in good health that get out and have those kind of responses. The people that are in bad health that are dealing with things have those kinds of responses. And I just wanted to have another conversation. I asked her to call her doctor in Tulsa, and she did, and he called me and said, I'm trying to get her back in the chamber. We're doing all the right things. But I don't know that she's going to be believing in that. So, and I haven't heard from her. So anyway, all that brought up what we're talking about today, because when you're dealing with cancer, there's a lot of other things that could have led to the cancer, that could show its head while you're dealing with cancer. But I don't think people will take all that into in fact, a group of people we just got out of the chamber with, several of them can point at why they have cancer because they really delved into it, and they're not going to do that anymore. Mold, Lyme is a co-infection, but mold is a big one that people don't realize. Maybe that's why they ended up with cancer.
Right, and so we're going to be, that's what we're talking about, kind of like co-infections or, things combining, to create problems. So, yes, so, the title is actually, this is part one of two. Right. Okay, so we got to have another conversation because we can't cover everything in this topic.
Well, let's do this again next week and follow up on it.
So the title, I called this, Do Infections Cause Cancer? And so we're going to go into the different types of infections and things that are related to that. But first, I'll do the disclaimer. And so this information we're providing is information. It is not a diagnosis. You need to get that from your doctor, and tests that are available through the traditional medical systems, valuable tests that are important. But the information that you learn, you need to use that and share that and integrate that into your care plan. And so we're not doctors. We're not telling you should do this or that. I don't think we're going to be talking about supplements per se today. Maybe next week. That's going to be another topic. And but if we do happen to mention supplements are not intended to diagnose, treat, cure, or prevent a health condition or a disease. So that's medications. Those are things approved by the FDA for that. But they can have impacts on our body and how our body responds to things. So check with your doctor, check with your integrative doctor, functional medicine doctor, practitioner, if you have any questions. They're the ones that are going to be more open to trying to figure that out for you. So anyway, we'll get started with that. And
we got a way to take questions.
Oh, yes,
we like to answer questions at the end of the hour, so send them in. And
send them in handouts. So I'm going to be referring to this. So that the handout is at hyperbaric.plus, and at Prevail Over Cancer, Hyperbaric.plus at the resources page. Is that right? Resources
Resource
page. And then on my Learning Center at the bottom of the page is this handout. And this is also being recorded on everything except for today. YouTube's not working. And so, but the other social media channels are working, so it's going to be available on those. But we'll also have recordings available of this too. And then, once again, we're going to go into more information next week. If you do have questions, submit those. Ryan's going to help us out, and he'll gather those questions, and so we'll go through that in about 30 minutes. And so let's get started, about this. So this is a fascinating topic, and so I think we have to be cautious and not allow clickbait things to get us, too excited and go down the rabbit hole too far. But there can be some things that are associated with, but you have to really look at the research behind it. And so, for example, I've mentioned before about how it's called a bovine leukemia virus, in unpasteurized milk, has been found in a lot of breast cancer tissue. It doesn't seem, so far, they can't say, and they've actually studied it quite a bit, because in some countries it's a significant issue, but we can't say that it actually is increasing the risk of it, but it is found in the tissues. So we have to kind of evaluate some of those type relationships. What's nice is that now science, I don't understand the science and how they can do all of those things. There's all kinds of acronyms and growth patterns and inhibition patterns and things like that. They now have the science where they can do a deep dive into these type things. So we're going to learn a lot over the next 5 years about co-infections and cancer, and we're going to talk a little bit more about those type of infections. So let me get off on my sheet here so I can make sure I cover everything. So it's estimated that actually 1 in 8 cancers are caused by infections. So that means, many of you have a problem with that. And so it's a common issue, and I always say assess and don't guess. So we have to figure out whatever that cancer is there a potential infection thing associated with that? If there is, we need to be testing for that, because we have to get to the source of that problem. If we don't get to the source, we can't expect different results, because that means a person may become NED at some stage, but if we didn't address the underlying source of the problem, it could come back, not related to that first cancer, or even a different type of a cancer. I have several clients that have 2 or 3 different types of cancers that they've had to deal with over time. So there are 11 agents that we are absolutely certain create problems, and I'm not going to be able to mention those names because some of them are Greek scientific names of these organisms, and so I would mess that up. Get your download at prevailovercancer.com, Learning Center, or Hyperbaric.plus resources, and get your download so you can see what these words are. But there definitely can be bacterial infections can create a problem, and we've known about that for many years. H. pylori, associated with esophageal and stomach cancer, and so I'm going to go through these different infections briefly, but then we're going to go into why they become a problem. So, and then viruses, many viruses are associated with this, and including HPV, 13 different types of HPV, okay, and viruses, and including the risk of cervix and anus and vulva, vaginal, penis cancers, and even oral cancers. Hepatitis viruses, B and C, Epstein-Barr virus, associated with nasal, sinus, Hodgkin's lymphoma, and stomach, and some other digestive type cancers. Kaposi, if I pronounce that correct, sarcoma. Matter of fact, I was exposed to that in the medical world 1977 when I first started working at a hospital pharmacy. That's associated with, well, that is, goes into a cancer associated with AIDS. And so once again, since 1977, we've known about that particular one. There's some other leukemia-type viruses, HIV that I mentioned just a second ago, parasites. And there's a few that we know are a problem, and so they increase the risk of bladder cancer, which is a squamous cell carcinoma type issue, and then a couple more that are associated with bile duct cancers that are actually more related to eating undercooked fresh fish. And so those parasites, you eat them and it gets into the digestive tract and into the bile duct, a gallbladder type issue, on that. And then fungal, definitely there are fungal infections directly, aflatoxins are known to increase the risk of liver cancer, but mycotoxins, that's a whole nother topic. We've talked about that before. But mycotoxins, which are byproducts of the mold and fungus, are also problems. And so, and why is that a problem? Well, we're going to go into that in just a moment. So, and the reason these things can create cancer, include things like, let's see here, I want to make sure I get this right, like HPV, actually such a prevalent virus. It actually has a protein called E6 protein that binds to P53. Are you familiar with P53?
I hear that all the time.
Okay.
Yes.
P53, I've actually got a couple of blog posts about that now, a recent one that I just posted and a video going into greater detail. P53 is a mechanism in our body that think of it as kind of like shaped like this. And matter of fact, it has to actually have zinc in it. That there's a 1 atom of zinc in here for it to fold right. If there's not enough zinc, it's not shaped right and it won't work. But this P53 actually goes along the DNA, our DNA, and makes sure everything is right. If it's not right, it actually calls in help to try to repair it. If that doesn't work, it tells it to stop growing and to die, if not even recruit, items in our immune system to attack it and get rid of it. But if the P53 is not working right, that turns off, that's actually our primary guardian. And half of all cancers involve a P53 that can't run along the DNA and correct it. So half of all cancers are related to a P53 issue. Wow. So, and some of these
test and understand that your P53 is or is not working.
Well, not easily, and that, but we can do. And I'm big about that. So, matter of fact, a couple of nights ago, I spent hours. Okay, what can we do? There's nothing easy to do for that, except we can do genetic tests, and we can find out if the tumor has a P53 problem. So the original biopsy, can tell us. You can go back and look and see if they tested for that. If they haven't, that's kind of frustrating. You can also do a genomic test. Like I did a genomic test on myself, and which is called a germline test, like what you and I have from our parents. My germline is not a P53 problem. Okay, the cancer that I have isn't known to be a P53. A skin cancer problem I have on my back is not known to be a P53 problem. So, but matter of fact, even prostate cancer starts out as typically not a P53. But after treatment, it loses the P53. And that's one of the switches that flip that makes it more aggressive.
Wow.
And so therefore, treatments have a tendency to accelerate that problem. So, but P53 is one of those mechanisms on that. And so that's the main protective thing in our body that helps protect us from that. So there are 4 ways that these infections, can create a problem. And one of them is going to be chronic, unresolved inflammation. So whatever that is, matter of fact, even, and we're not going into that today, but autoimmune disease can create some inflammation in the body.
Isn't autoimmune disease inflammation in the body?
Yes, it can, but it creates inflammation too.
But I've never seen an autoimmune disease germ.
Correct. It's not a germ. That's right. Well, it's not a germ, but germs can contribute to it.
Right, but I see that as kind of not an easy way out, but an explanation when there isn't one. It's autoimmune. It's an inflammation that's constant. Right.
Yes, and matter of fact, I have some experience with that myself, and so I've had some long-term inflammation. I actually have some genetics that lean toward that. My genetic profile says that I have a tendency to make a lot of IL-6. That's one of the worst inflammation markers, or inflammation chemicals in the body. I have a tendency to make that, so I have to take things to help suppress that. And then gut health for autoimmune is very important, and I've corrected both of those type of items for the most part, and now I test negative for rheumatoid arthritis. So I don't have the long-term chronic pain issues. I can have some weird things if I don't eat right, and that probably is actually throwing off an immune response in my intestines. With that.
Wouldn't it be fair to say rheumatoid arthritis is an autoimmune disease?
Oh yes, it is. Yeah, rheumatoid arthritis is autoimmune, lupus.
So you can correct it if you can handle the inflammation. You can change the direction.
It can get better, yes. And I don't want to mislead anybody. Mine went from where I definitely had rheumatoid arthritis, test positive, had problems, to where I don't have the problems and I test negative for it now. So yes, it can get better if you address the underlying problems. And so that's actually what we're trying to do today too, is address some of those underlying problems that can contribute to cancer and or cancer growth with that. So yes. So matter of fact, I just had another thought too. Dr. Debbie Osment, okay? We need to have her on here.
Oh, I'd love to.
Yeah, I'll contact her and have her come on. And so and one of the things we're not really going into deeply at all, but bacteria can be an issue for colon cancer and colorectal cancer, and the bacteria actually starts in the mouth. And so she does some DNA testing of the bacteria in the mouth, and some of those are actually responsible for increasing the risk of the inflammation and colon cancer.
So we're starting to see biological dentists do this before they do a procedure. They want to make sure they're not exacerbating something.
Exactly, yes. And to help do that, go slow and low before jumping on board and hitting it hard. So so I'll contact her and we'll have her come on. So it should be a great. She's a live wire, so she's great.
I've never met her yet.
Oh, you haven't? Oh, you haven't met her? Okay, I thought maybe you had. So yeah, she's great. So she does have social media. I think at Dr. Debbie, I think is the name of her Instagram profile. So okay, so unresolved inflammation. So infections can create inflammation. All of these infections, whether it be viral, bacterial, mold, whatever, okay, fungus, they create inflammation, and inflammation is a driver of cancer. And I actually have seen that in my clients. Matter of fact, I just got a test back on somebody, and his HSCRP was over 20. Matter of fact, the lab can only say greater than 20. They don't even know how high it is. And so we that's what we're going to jump on that. We got to bring that inflammation down, because that is a stimulant of cancer. So the inflammation that's unresolved and going on for a long period of time has a tendency to stimulate that cancer. So cancer is also not an instant type thing. It is because those cells are going to happen, and our immune system is supposed to get rid of it. But if we have the chronic long-term inflammation, that just feeds that system, and it keeps our immune system from attacking.
So I hate to. I want to ask the question, but I don't want to go down this rabbit trail. I don't think.
Okay.
Mitochondrial dysfunction, when our so metabolic dysfunction. So when our mitochondria gets damaged and doesn't repair itself timely, we use red light therapy here to try to enhance that. That's a great. I don't know other tools. There's some others. Even always diet.
Yes, right.
But the red light therapy, if you can maintain that metabolic function, then that addresses the inflammation as well, correct?
It does.
That's another
address
tool.
some of it. That's correct. Exactly. If the cells and the organs working better, that helps to get rid of those toxins and the inflammation out of the body. Yes, that's correct.
Okay.
So mitochondrial health is very important with that. By the way, if you're just now tuning in, you go to hyperbaric.plus resource page to get the handout for today's seminar. This is part 1 of 2. We're going to go into more like some items that help fight these infections, and then submit your questions. And so in about 15 minutes, we're going to be having answering questions online. So primarily, we're talking about infections today associated with cancer causes and growth. We can answer other questions too, but that's our primary focus today. So sustained antigenic stimulation. So what that means is, so we have this infection, and it's actually going to ramp up the immune system to fight that, to get rid of it. And so like if a person has a spider bite, okay,
Right.
so
Thank
so I'm picking on him a little bit, but something happens, but you know how bad you felt. If you have something like that going on all the time, eventually your immune system is going to go, forget this. It's exhausted.
Yep.
Cannot help you. That is a cancer risk. And so that's actually part of even like autoimmune issues. You know, their immune system is haywire and gets tired and flips a switch and goes the wrong way. So whether it be no matter what type of infection it is, it can create an antigenic response and weaken the immune system to where it just says, we just can't do this any longer. You've used up the nutrients. We're tired. We just got to take a break. It's our immune system that attacks the cancer cells and gets rid of them. So that's going to be one of the methods. And then also, for example, along that line is going to be the Epstein-Barr virus. Epstein-Barr virus, which is mononucleosis. A lot of these viruses, in each HPV, Epstein-Barr, all these viruses, these type of viruses, are in our body forever. We're exposed to that typically as a child, and it's in our body, and our immune system keeps it under control. But if our immune system doesn't have enough support, for example, if there's enough stress that weakens our cortisol, which is part of our immune system, weakens the cortisol response, now we're going to be more inflamed, and so now we're going to have more problems with cancer. So the Epstein-Barr is one of those classic type things. So it causes a drop in the surveillance on the body's ability to get rid of that virus, and so that starts infecting cells and creating more inflammation, and that's going to be more problems and wears out the immune system if you want to think of that. And there's a few things, but not many, that create a true genetic genotoxicity that damages the genes in the body, the DNA directly. And so aflatoxin is the main one for that, and that's more like a liver cancer. Now, there can be aflatoxin can also increase a risk, and so several other mycotoxins increase in that inflammation, and is associated with other cancers too, many other cancers. So even some brain cancers. We got a couple of people coming here for that. I've seen their results, and so mycotoxins that are associated with that, and then immune exhaustion, and that's part of that actually sustained antigenic stimulation, the immune system responding to something, and then that wears out. So fourth is going to be the immune exhaustion. The immune system is tired. It cannot keep it up, to get rid of that. So they have the P53, can be attacked, and or run out of nutrients. So for example, like if you have a virus infection, our immune system uses zinc to work better. And so if we're having to make a lot more of those immune cells to get rid of that virus infection, the zinc is going to go to those cells, and now the P53 doesn't have enough zinc, so now it's not shaped right, and it can't repair cells. So there's this cascade of effects that can happen, in the body. Let's see, what else? H. pylori, which is actually part of the best studied, and it's an infection that actually, I don't know the statistics on that, but a large number of people all over the world have that. It actually is a contagious bacteria infection, and matter of fact, it's thought to even be in our drinking water, in the public water systems, and it is transmissible from one person to another. But why is it but it's not like it's going to damage and create a cancer in everybody. For example, one person in the family is going to get stomach cancer, but nobody else gets it. They all have the same bacteria because actually their immune system and other factors allow that to happen. So it's the same thing with mold. It's like not everybody's going to have liver cancer from that aflatoxin exposure because their immune system was able to compensate for that. So it comes back to mainly about the immune system.
Well, it's crazy how many people come in, their house has mold in it, and one of them's affected and the other three aren't.
Exactly, yes.
Because somebody's immune's down and the other ones are maintaining, but that all has a possibility of coming to an end if you don't take care of the source. So.
Exactly, you got to get to the source. So that's when I meet with my clients, that's always my question is, okay, so if they have this particular type of cancer, what are those factors? You know, yes, the genetics, that's part of it, but what else could be going on? And we're looking further like this inflammation, you know, are there inflammation markers? Yes, that's inflamed. Okay, well, we got to address that, but still it's like, okay, well, why is he inflamed? What is, driving that, in the body? And I have to admit, some of the cancers will create their own inflammation. That's, it's pain, it's red, it's sore. That creates more inflammation, factors too. So that will be part of it. And then parasites. And so this is a popular thing. So parasites, the thought is that since there are anti-parasite medications that have anti-cancer actions, then that, cancer may be caused by parasites. Well, it's not quite that simple. And so there are some associations, yes. And as a matter of fact, even some studies showing that, in the tumor itself, they're finding some DNA from mold and fungus and other things, and maybe even viruses. But we still need more information on that, but it might be a co-infection. So that tumor itself is not the healthiest place in the body, and it is a place where, matter of fact, Dr. Thomas Lodi, I like to follow him on social media, he calls cancer CFCs, chronic fermenting cells. Okay, so they use, well, matter of fact, let me stop a second too. That environment of high glucose that allows cancer to fuel its growth also fuels parasites, and it also fuels mold and yeast and other things in our body too. So we have to be healthy, in what we're eating, and doing intermittent fasting and being careful about those sugars. And so that sets up an environment that encourages all of those things to grow. So we have to be very careful about that. So the parasites, right now we're not seeing direct evidence on it yet. There are 3 parasites that I mentioned earlier about the bladder, and what was the other one? I can't remember. But it's the inflammation, is the direct issue. The fact that there's this parasite in our body, and it's try to put this, it's irritating and living and moving around, and it is creating inflammation inside our body. Therefore, it's a driving factor, for cancers. That appears to be one of the major things, in the body. So mold, it seems to be at this time, from what we know, it appears to be the mycotoxin is the problem, not the mold itself, but it's the byproducts of that. And then Lyme. You have a lot of people with Lyme coming in. So the Borrelia officially is not classified as a carcinogen, but it's
bringing the body down.
It's bringing the body down, creating inflammation. And there's actually one little thing that's kind of curious they're watching on this is actually called a cutaneous marginal zone B-cell lymphoma. And so there are certain types of lymphomas that might be related to that. So once again, they're researching it. We're learning, but it comes back to, it's irritating a tissue and cells. And if that's going on long term, that creates an environment that sets up, inflammation and growth. and that just creates that allows that one cell to start growing. So increase nutrient deficiencies. By the way, so we just have a couple of minutes. We'll start the Q&A. So submit your questions, and we'll answer those online in just a moment. Ryan will print those off for us. So let's see here. What else are we going to talk about? Vaccines. And so I personally am not a big fan of vaccines. I have had some negative responses to some, but it's kind of curious. So, in there's an HPV vaccination study in Scotland where they had almost 450,000 young ladies. They were 10 to 12 years old, that they did give the vaccine to them for HPV. I'm not saying that you should do that, but they did that. And actually, the girls that got that vaccine, whether they got one shot or two or three, I don't know what that protocol is, but even if they just got one shot, not a single one of those girls got cervical cancer. Okay? So once again, this is not a time to debate vaccines or not, but HPV is out there. It is definitely a cause of cervical cancer and several other cancers. So by shutting down and preventing that infection, it reduced those cancer rates knocked it down to zero. So therefore, 450,000, not one case of cervical cancer. So, and I don't know what that rate would be, but it was an amazing, statistic. Now, there can be side effects from vaccines. So I have experienced that. So I'm not, do
your research.
Yeah, do your research, and we have to weigh the potential benefit with the potential concerns, and weigh that. So, but any type of an infection, whether it be virus like this or like in that case, that virus actually stays in an area and it just continually growing and damaging cells, and eventually we have a chance for a cell to become damaged that can continue to grow and keep passing that on. And so that's, we'll say, cervical cancer or other HPV type cancers. So with that, H. pylori, as a matter of fact, there's a move right now to actually, one study came out, suggested that if in a country, I can't remember what country it was, that they could reduce the risk of stomach cancer by about 10 or 15% if they just screened for H. pylori, if they screened everybody. And it was actually a pretty remarkable number of people that would not die from cancer because they could shut that bacteria down by doing antibiotics. Now, what are other things we can do to fight infections like that? Have a healthy lifestyle, eat the right foods. And then there's some natural type things that we can consume and eat, and or supplements that help support our immune system too, so it works optimally. So zinc is one of those things. We've talked about the zinc taste test, about how important that is. We can do a zinc taste test, and as a screening, switch that zinc solution, swallow it, and if it tastes good, you're low in zinc probably. And so that's going to be a risk factor for infections. Matter of fact, every single thing we talked about today is related to a low zinc status.
That's why, every time there's something in our household where somebody's got any kind of illness, typically virus, my wife jumps out with the zinc lozenges. That's the first thing that hits. There's a bag of them on the counter. It's what you need to get this zinc in you. Get the zinc up. So,
matter of fact, many years ago, in my pharmacy, this was back in the 1980s, we knew that zinc lozenges help reduce the severity and the length of a cold.
Yep.
And so, and it's kind of interesting. I would put a zinc lozenge in my mouth, and the first one tasted good. Here's our questions.
Oh, and then it went south from there.
And then, as the day went on,
I never thought about that.
I didn't know why, but now I do. And then later, after I'd done my fifth one, I'm going,
had to spit it out.
Oh, it's horrible. I didn't want to do it. And so that's one of those things.
Yeah, zinc
so
levels
that
are
is
up.
one way to.
I would have never thought about that.
Yeah, one way to get an idea about that. So
Cool.
do those lozenges until they taste bad. So it is another option. Okay, so let's see what else. So we can also test for these viruses. Be sure and test for those. Address what you can, and get into the source of the problem. So always, if you have a problem, try to figure out why is that. And then we have to take care of our body, the terrain. And so Dr. Debbie, I'm going to love to have her on. So she'll be great. So I don't know if we have enough stuff for all three of us to.
I use a biological dentist, a different one than Dr. Debbie, and I went in for my cleaning, and she wouldn't work on me until she got the results on my testing, and then everything happened with a storm, and I've got to get back to my dentist, but she was concerned, and she does that before she even does, I think, cleaning at this point, because it's going to spread all that bacteria if it's there.
Spread that bacteria, so they know ahead of time what they're dealing with, and or sometimes we have to do medications and treatments and surgeries and whatever.
She put me on a little protocol with a tooth and gum tonic, and I can't remember the other things, but she put me on a little deal and said, come back and see me in a month and a half, 6 weeks. So,
okay, good. Yeah. Okay,
here.
Let's see what we've got on Q&A. Okay, so
yeah, some of these things we're not going to.
So
thank you for the question.
Yeah, I can't say this one because it will get us banned. So I can't go into that. So I'm sorry. I just can't say that.
Yeah.
So much appreciated information. Thank you. And Hep B is strongly linked to multiple myeloma. So yes, so hepatitis virus. So once again, inflammation, and I think part of our problem is that we just haven't really studied this good enough yet. And so about that. So matter of fact, I want to get a shout out to a friend of mine in the United Kingdom, Mark Lintern. And so he's a gentleman that's actually spent years researching, has written a book. I mean, this book is it's thicker than the Bible, and has more references than the Bible too, where he went through the medical journals about cancer and fungal type issues. Okay, and so Mark wrote a book, Mark Lintern. It's called The Cancer Resolution. And so, help trying to justify ways to assess and get to some of the sources of the problems, of that. So I'll put that on my website too, on that. So I've been wondering if hyperbaric therapy is going to help my leukemia CLL, which I discovered I had last year. And so hyperbaric.
It's a tool.
Yeah, it's a tool. It's part of the picture.
Yeah.
And so I view hyperbaric as improving circulation and helping the whole body overall. Okay. And matter of fact, I took my supplements and repurposed medications before I came. So that will help, because this system will help open up the blood vessels, improve circulation, and help get those things everywhere. So throughout my body. And are cold sores linked to cancer? Not that I know of. And so that is a herpes virus. And right offhand, I don't know of one that it is directly. So not that I know of. You should look into bitter melon and curbitacin. Which has beneficial effects on for leukemia. And yes, actually all of the melons have this curbitacin, if I'm spelling that or pronouncing that right, and that's like cucumber, curcu, and so that's those melons and vine type products do have those chemicals do have anti-cancer type effects on many different types. The challenge is getting enough of them, and so we can't really say that eating that melon is going to be good enough, because we in cell studies, yes, it has anti-cancer actions against whatever cancer, but can we get enough in our body?
That's why they make tinctures, and
tinctures, if things can help out,
with
high
concentrated products.
And then also in our eating, eating a wide variety of healthy foods and not the junk foods, help out with that.
And variety. A lot of people, they find one good food and they consume a whole bunch of it, but variety is real important when you're finding the therapeutic foods.
Right. In the case of mantle cell lymphoma, Hodgkin lymphoma in remission for 1 year, and now nodules appear in the lungs, what can be done? So even with that, I don't know enough information to be specific. I'm not allowed to say specific things on social media, for that. But we've got to get to the source of the inflammation, and infections. What else is going on? What about that inflammation? Have they done IL-6? That's an inflammation marker. HSCRP, another inflammation marker.
Have you ever done a mold test in your house?
A mold test,
so inexpensive just to see if you can grow mold in a petri dish, and it's amazing how many people.
That's right.
And that's going to be a constant inflammation. It's not going to go away when you live with it.
Talked to a young person yesterday, compared to me, young to me, and so about his health challenge. And that's one of the questions we had. Okay, have you tested your house? Yes, I've tested my house. No mold. And so, but we don't know why his cancers, why he has this early onset cancer. And so that's going to be maybe one of those things. So I've got all of his labs, and so I'm going to be going through that now to try to look at things a little bit more. Thank you, sir. Where are you located? Thank you, sir. That means they're probably not from the United States. So other countries tend to be more polite. But anyway, you're welcome. And we're located in Oklahoma City area.
But your clients
but
are
my
located.
I have clients all over the world, okay? And literally all over the world. So I meet with them virtually. We do Google Meet, we do WhatsApp, whatever we need to do. So, yes.
Send labs and get answers.
Exactly, yes. So my sister had cancer on her scalp, had it removed. Her skin on her head did not heal properly. Would this work for her? I'm not sure what you mean by that, but actually, I personally, if I had an issue like that or a family member, I would be doing, the hyperbarics and red light.
I got pictures where I grew my large cancer removal off the top of my head.
Okay.
And I did hyperbarics. The doctor said there's no way that I would close that wound. And in the 1 year that it would take to close that wound, I'd get an infection, and it's next to my brain, and blah, 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 blah. I asked him if he wanted to take pictures. And so I grew it back in 5 months. It closed, and I have, instead of a gigantic bald spot with belly hair growing out, which they wanted to graft on my head, I've actually got hair.
Real hair.
So anyway, kind of crazy.
Yeah. So yes, I definitely, and once again, I can't say specifically, but I would also be looking at hyperbaric and then also red light, to help do that. I do red light almost every night. And so it's part of my routine.
Yep.
So, so any known infections associated with thyroid cancer, do you suggest any tests in it? So definitely, Epstein-Barr virus is associated with several different, a couple of different types of thyroid cancer. So yes, EBV, Epstein-Barr virus, there's a panel. And so, matter of fact, most of the populations has a history, and so that's going to pop up and say, yep, you have a history of EBV, but do you have a current infection? And so that's where we're looking at IgG, IgM, and IgA. So we need to know the history, but is there anything currently going on? So get a EBV panel, to find out. And so that would be one of those things. And I actually usually go with it. Well, any type of cancer, I'm supporting the immune system, but definitely for that type. How to resolve on a not invasive way hidden mouth infections. How to resolve in a not invasive way hidden mouth. Okay, how to help out with mouth infections. And so it depends on what's causing those infections, and if it's there's several different types. So hidden mouth infections, I'm not sure. I'll tell a story about the microbiome in the mouth. If you're doing things like, I don't want to say names, antiseptic mouthwashes, those kill good and bad bacteria, and they have a tendency not to kill everything, and allows overgrowth of the wrong type. So now we get infections. Now, there can also be some ulcers that can be caused by virus infections. So so I'm not sure how to answer that question for sure, but a proper microbiome, that means the bacteria from this area, the sinuses, the mouth, the esophagus, throat, stomach, and intestines, is all interrelated. I've had people come to me. Matter of fact, I had a doctor send me their patient. He had a sore esophagus, and so they did an EGD, a scope to look in, and instantly yeast infection. And so that was what was creating his pain. I mean, severe pain. And so they, after he got out, they said, well, we really couldn't see everything because you had so much yeast. It was growing over your esophagus. We couldn't see the esophagus tissue even. And so you need to go see Keith, to get things to take care of that. And within 2 days, he had no pain. Okay. And so we just put bacteria in the mouth, and instead of swallowing the probiotic, well, he put it in his mouth, used it as a mouth rinse and gargled and swallowed it, and pain went away. He actually did that protocol for a couple of months and did perfectly fine. So, but the underlying cause was not enough stomach acid. And so he didn't have enough stomach acid to kill the yeast, and is allowing the yeast to grow. And so because he didn't have enough of the good bacteria to crowd out the bad stuff. So potentially, to answer that question, I'd be wondering about your stomach function. And if you're in an acid state or not, that's one of those signs. That means you're not absorbing nutrients, and you may be lacking stomach acid. Can you please share all of this that's been discussed here, like all those bacteria, parasites, viruses, and history of that might lead to cancer in the future? So, yes, I believe, if I understand that question properly, I know I mumbled a little bit then, but yes, we're sharing this handout is, at prevailovercancer.com Learning Center page, and at hyperbaric.plus at the resources page. So we have this handout this week, and then next week we're going to go into more like items that can help address the problem. So today we're talking about setting it up. Okay, these are the problems. Yes, we have these things in our body. Now, next week's going to be what can we do about it?
So when you start that whole deal, it's don't guess.
Assess. Right.
That's the first thing, because if you don't know what you're dealing with, how do you know how to deal with it? So
that's right.
You got to do that up front. And Keith, we're pushed up to the hour again. And thank you for every once in a while I get somebody comes in and nudges me, and I'm like, man, how do I get this out there? People aren't even thinking about it.
Right.
I mean, this gal is going to all these doctors, and no one's asked her these questions.
It like a side effect. If you have a side effect, it's like, why?
Yeah.
Okay. You got to step back. Why did that happen? Okay. And let's address that. So
because we don't want it to lead to worse things.
Yes, that's right.
So anyway, Keith with PrevailOverCancer.com, a great friend and a resource. I sent 3 people to you last week because they're asking me. Somebody said my wife's got carcinoma, and I said, as much as I know, that's usually 3 words long. Carcinoma is not enough information.
Right,
so call Keith so he can ask you that question, and then you can start down that path of answers. So anyway, I'm Paul with Hyperbaric.plus, Hyperbaric Plus in Oklahoma City at 122nd and May. And Keith's here every Thursday. Come dive with him. I mean, Thursday at 10 o'clock. We have a blast.
Yes, we do.
We all learn a lot. That chamber is just bah, 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 bah. Everybody's learning in there. We love it. And that's a little community we've built here. So anyway, we will be back with part 2 next week. Ryan, as always, thank you a million.
Yes, thank you, man.
Appreciate you. And even though they threw you a curveball with YouTube this week, we'll work through it. So we will see you next week. Thank you again for showing up. Keith, we'll see you then.
Okay.
Thank you.